How did you get involved in this work?
I actually received my position while I was going to grad school at North Dakota State University for the Masters of Public Health program. And I interviewed for the position and found out that it was going to be about tobacco.
Tell us about your coalition.
We have had a standing coalition for about 8 years now, and our coalition is focused on reducing tobacco use amongst youth. And right now we are working on raising the age to purchase tobacco to 21 in Ottertail County, and we are also working in Becker County to place e-cigarettes under the Minnesota Clean Indoor Air Law.
What does building community support look like for your coalition?
I really enjoy partnership building. It's really as simple as a cup of coffee. You go and you meet with community stakeholders and just sit down with them, drink a cup of coffee, talk about the work, talk about them. They have to know that you care about them, because if they know that you care, then they will be interested in what you're talking about. From there, everyone can get behind helping youth be healthy, and so you can find common ground, and from that you can lead your friends to new friends, and together you can work on policy. I met with one of my community stakeholders, a great champion in the area, and it literally started over a cup of coffee. We met and started talking about the area. This individual actually works as at the time, she was the community health manager for one of my county seats, and she knows a lot of people. That conversation started, she got really excited about the work, she really related to it, and she suddenly was bringing doctors to the table. Then she was bringing city council members that she knew to the table. Then she was bringing media that she knew to the table. One person led to an entire coalition's worth of work, and it all started right there with one cup of coffee.
How does this sustain prevention?
Policy ends up making stronger connections. It makes lasting change, because we all know that our work is grant funded, it could be time limited, but even if something was to happen and your position wasn't there, a policy is hard to roll back. And so if you can get a policy in place that will actually make real change, lasting change in an area, you can make a healthier community for years to come.
How do you think sharing this will help others?
So something I would really like to tell anyone that is new to the work or has been doing it for years, remember your passion. You came to this job for more than a paycheck. We all know that public health isn't where we're going to get rich. We're here because we really care and we want to help people. So keep in mind, this can be difficult work. There will be times when it's discouraging. There will be times when you'll have great wins and there will be great celebration. Keep that in mind while you're working. Keep your passion in mind, because that will sustain you through times. Go back to your coalition, talk to them, encourage them, let them encourage you. Always know that there's a friend out there who will always want to help you, and you are making real change. That's so important.